warmest welcome to the third commencement exercise of the Jindal School of Public Health and Human Development, the 12th and newest school of this university, as everybody knows. It gives me particular pleasure to welcome Dr. Rama Baru and to be in the presence of our very distinguished Vice Chancellor, and soon the Registrar will be here, and to have our faculty and students and guests here is a wonderful opportunity for us to reaffirm what we hope is the unique feature of our School of Public Health. This school exists thanks, and I am not saying this to be flattering in any way at all, but thanks to the inspired leadership of Siraj Kumar, our Vice Chancellor, who understood that unlike other universities who have had a School of Public Health as a small appendage of a medical school, this university is capable of launching a School of Public Health with a distinctive feature that is not dependent upon a school of medicine. Our particular feature, and this again I attribute to the wisdom of our Vice Chancellor, is to combine the conceptualization of our school with the understanding of human development as a challenge to all societies that may favor growth, but need to understand that growth is a means and not an end to development. And public health is an essential feature of the life that societies seek to achieve. A School of Public Health, as we hope excuse me, our students will appreciate, draws upon the learning and the faculty in the well-known fields for people who specialize in public health, not only of medicine and epidemiology and biostatistics, and bioethics and demography and economics and environmental studies. These are the areas you expect to benefit from in the study of public health. However, public health, as those who have been able to engage in this study in institutions around the world, know that we also draw upon specialists and genuine full-fledged trained people in the fields of history and political science and law, anthropology, human rights studies, humanitarian studies, philosophy, psychology, sociology, development studies, and so on. So what we have embarked upon for the last 3 years is an experiment to see whether we can integrate fully the understanding of human development into the teaching and preparation of careers in public health, and do it in a way that draws upon all relevant disciplines. We are very conscious of the fact, as the World Health Organization has proclaimed, and I'm quoting, "Knowledge derived from research and experience may be of little value unless it is put into practice." So our training in public health is geared towards preparing our students to embark upon a practical experience in which not only the skills that they have acquired in the various courses, but also the exposure through internships and placements can prepare them to engage in the public sphere and in career paths that are meaningful. So what we call the no-do gap, translation of research and academic learning into something that has an impact on society, leads us to aim for our students to be able to strengthen the national health system of India, and the Lancet Commission on Reimagining India's Health System has underscored the specific needs in this area, leads them to be engaged in global health governance, where they can be world leaders, contribute to building up the institutions and processes that address such issues as pandemics and challenges to global health, and similarly in the humanitarian sector and the mobilization of civil society organizations to engage in these areas. So it is a wonderful challenge and opportunity for this new batch to become part of this exciting enterprise. And I am particularly honored to be able to turn the floor over now to our Vice Chancellor, whose inspiration, as I said a moment ago, is at the foundation of this very school, and whose leadership we treasure to have made this school possible. We're looking forward to a very exciting program with our new students and our continuing students and our wonderful faculty. I must say that as Dean of this school, I couldn't be prouder of the extraordinary faculty that we've been able to have join us here, beginning, of course, with the Vice Dean, Nandita Bahan, and all of the faculty members who are here. For today's session, I want to express a special note of thanks to Professor Sneha Krishnan, who has taken the leadership in preparing today's session. So with that, I want to welcome you once again, everybody, warmly to this commencement for the third batch of the Jindal School of Public Health and Human Development, and turn now to our distinguished Vice Chancellor. Thank you.
Thank you very much, Steve. And first, let me extend my heartiest congratulations to all the students who have joined the Jindal School of Public Health and Human Development at Hopi Jindal Global University. You are not only our newest school in the university, but also have always been a very small and a very exclusive cohort. And that essentially means that you end up getting the highest attention, not only within the school, but also beyond. So I want to extend my heartiest congratulations and greetings to each one of you. I also want to thank Professor Dr. Rama Baru, a very distinguished professor at the Center for Social Medicine and Community Health at Jawaharlal University. Spent an entire lifetime of pursuing research and contributing to institution building, and to be able to inspire multiple generations of students and other professionals in the broader field of community medicine, community health, and public health. So thank you very much, Dr. Baru. It was also very kind of her to have accepted this invitation at short notice. I also want to thank my colleague, Professor Deepika Jain, Vice Dean of the Law School, who made a frantic call to Dr. Baru yesterday to request her to be able to be present here. Although Dr. Baru is no stranger to the school and the university, but it was very kind of her to have accepted the invitation, especially when our originally scheduled commencement lecture person was not well. I also want to take this moment to thank all the faculty members at the Jindal School of Public Health and Human Development, and also my dear friend and my own mentor, Professor Stephen Marks, who is the Dean of the Public Health School. Steve, as all the new students may not know, but spent more than 20 years at the Harvard T.H. Chan School of Public Health, and before that held stints at Princeton and Columbia and at the United Nations and Ford Foundation, and has had a very long and distinguished career working in the intersection of human rights and human development, and also worked in the field of public health itself. So when we were establishing the school, he was our obvious choice to become the dean. And I always say that Steve quite remarkably left the tenured professorship at Harvard and moved from the city of Cambridge to Sonipat. That's not a call that usually people take, but it was because of his commitment and dedication to institution building and his passion for the field of public health, and to have the possibility of creating a new public health school in India and to build the next generation of professionals in the field was his motivation to do that. So I think all the students here, you can understand the seriousness in which this school and this initiative was built. I want to begin by saying that public health as a field and as a discipline, at least in the Indian context, has been for many, many years seen as a kind of ignored cousin of medical education. Basically, it's all medical schools having some sort of a public health. It's almost like, it's something that you can just do it on the side, in various names. Medical schools have used it, community medicine and all of that. And also, it was also so integrated with medical education. So even when public health schools were established, it was largely the universities which has a medical school. And so we were very conscious of the fact that our School of Public Health will have strong emphasis on humanities and social sciences, but also have a very foundational, pedagogy towards public health studies, including some of the core subjects that you are all studying. But I think it is also important to recognize that you are also part of a larger university. There are 11 other schools where there is a law school, a business school, a school of international affairs, a school of government and public policy, a school of liberal arts and humanities, a school of journalism and communication, a school of art and architecture, a school of banking and finance, school of environment and sustainability, school of psychology and counseling, and a school of languages and literature. I mentioned those 11 schools, and then the public health school, which we started as a 12th school, is that public health is one such discipline which cuts across all these 11 schools, because all of them will play a very important role. For example, if you are looking at issues relating to health and health as a human right, then inevitably the laws, the rules, the regulations, and the interpretation of those laws makes a huge difference, even from the standpoint of seeking accountability when it comes to these matters. The business school and the banking and finance school is a major important part, because we are still struggling to develop the financial model for public health. To what extent privatization of healthcare centers or healthcare as a service is viable in a country where large number of people are not able to access healthcare. So there is a whole range of issues where business and bank and finance becomes important. Public policy, for example, we've gone through a whole COVID crisis, and the heart of that COVID crisis is not only about the lack of adequate preparedness when it comes to public health, but equally important was the lack of policy apparatus that was not available to address these type of issues. So you can't ignore the importance of public policy, but also the role of government agencies, a role of government bodies, role of both the bureaucracy and the politicians when it comes to recognizing public health as a central factor for the future of governance. When you look at architecture, for example, relatively, one would think that what could architecture possibly be connected, but absolutely, to what extent issues relating to disability and access becomes important for the kind of public spaces that we are creating, to what extent cities that we build and urban spaces that we are creating take into account the needs and aspirations of, let's say, an aging population. These are all, examples of why public health as a discipline cannot be bracketed with a very myopic approach towards its teaching and its learning. I can even think of both environmental school that we have, or other schools, for example. In a way, public health is one such area, and especially when it gets combined with development, which is what our school is and what you are studying, you have the potential to be the kind of person who can play a leadership role in addressing the big issues of our time, what kind of cities we want to build, what kind of society we want to create, to what extent rights-based approaches can actually help in addressing public health challenges, what kind of policies and regulations ought to be created for bringing public health to the center stage, to what extent funding and resources matter. Should we rely upon the government totally? Should we rely upon the private sector? Are there public-private partnerships which can be more effective in some aspects of healthcare delivery? In a way, you are being challenged to recognize that public health requires a more interdisciplinary, even a multidisciplinary approach towards understanding these issues. So that's why I think a multidisciplinary university such as ours, but also the kind of faculty members who have come together within the public health school will help you to develop that perspective. I also want to mention that unlike many universities in India and abroad, our effort to promote multidisciplinarity is deeply embedded in our commitment to providing opportunities to students to take courses across the entire university. You may just be aware or made aware of the fact that while you have, n number of faculty members in your school, you actually have access to 1,200 faculty members in the university. Every day we offer 500 electives across all schools for no additional charge, and all students, unlike the entire Western world where fee is connected to credits, we don't do that. So whatever fee you have paid will give you access to the entire university's courses, regardless of whichever school or program a professor is. And I know that your school enables you to kind of take courses across other schools of the university, and we do it in a very programmatically viable manner. With the morning till around 3 or 4 o'clock, you have core and elective courses in your own school, but after 4, almost till 11 p.m., we offer these cross-listed electives that are available for you as students of public health to take that as well. The last thing I want to say is that there are some disciplines in particular, and I can definitely talk about law, but also public health, but also other disciplines too. We need to promote a stronger approach towards experiential learning, especially in the master's programs. You're all students who have completed your undergraduate degree. Many of them have work experience. So I want to challenge you, both the faculty and the students, that don't limit your imagination to what happens in the university. I want you to pick up projects in the real world. We are in Sonipat, in the state of Haryana. There are so many challenges in the neighborhood relating to public health. You should be visiting the primary healthcare centers. You should be out there in the field, looking at real life issues that are contributing to the overall health of the district. The district of Kurukshetra, where our chancellor is now a member of parliament from, he will be needing a lot of guidance and support. And more interestingly, we can make real impact in these places because we can also contribute to the policy making agenda, and impactful interventions in the field of public health are possible. So I want to challenge the faculty. While I'm a strong votary of faculty members pursuing Scopus publications, I also want to suggest that the faculty members should be working closely with students to be able to make impact. In fact, our chancellor, whenever I talk to him about our Scopus publications, he's so not impressed, because he always asked a question about the fact that what has that research impacted ordinary people, livelihood of it. And of course, as a university, we need to balance so many things, and that's a longer conversation, but I can't have longer conversations with him. But all I can tell him is that we are working on it. So, and then I know for sure that not every student, especially undergraduate students, are in a position to do that, because they need to have their foundational learning. They need to do things which may not necessarily have immediate impact. They need to study, Tolstoy. They need to study, philosophy and political science and history and literature and disciplines which may not have immediate impact, at least their own work. But as students, especially in the master's program, as people who have come with your undergraduate degree and also lived experiences in your life, I think you have a larger responsibility to connect the theory with the practice, to be able to have a more practicum and experiential learning opportunities, to be able to do real life projects, to actually integrate that with learning. Because, and that's what faculty members, I hope, will do, because we are right here. I mean, there's something to be said about, if you are, let's say, a student in Denmark or Luxembourg, the possibility to address some of the most fundamental challenges of public health and human development is very limited. You can still find some issues in those countries, I'm sure, but we are right here. Just step out of the campus. There is, so much to do. It's like a laboratory that you are part of. So please make it a point to challenge your faculty as students, to be able to connect theory with practice, to be able to move beyond the reading list that the faculty members, give you, to be able to constantly ask the question how we can impact the real life of ordinary people out there. and those are not easy answers. I mean, for example, there is, when you end up having ideological positions about healthcare, be it private or public, it ends up becoming more, divisive. So, and that's why in education also we see the same thing. I mean, we are part of a private university, and sometimes people end up talking about the privatization of higher education, and I always say that the reality today is 70% of higher education is private. 70% of students are studying in private higher education institutions. So, you will be foolhardy to think that the state and its instrumentalities can address the problems of higher education if you don't recognize that, private sector will and indeed play a big role. And the same thing goes with education, health as well. So, in a way, I want to end by saying that this is an extraordinary opportunity. We are very excited about it. We consider you as a very special cohort of students who have joined a relatively new school. And I think we are also sitting on an extraordinary opportunity to make a change, and I hope you will be. I want to end by saying to Dr. Rama Baru that, Dr. Baru, in the year 2009, I kind of naively developed this tradition of having a commencement lecture to begin the academic session of every school and every program. That was an innocent act, but I am paying the price for it even now, because that essentially meant I was there in one lecture in a year. And then as schools became expanding and programs became more, we have now 14 commencement lectures. And I now make it a point to greet the students and welcome them, and of course meet the speaker, but it also deprives me of the opportunity to stay through the lecture, so I want to seek excuse from you, and I will be leaving shortly, but I just want to say that how delighted I am that you are here, and to mentor the students and to engage with our faculty. Your lifetime of experience will be a great source of inspiration, and I really hope that we can involve you more substantively in what we are doing. We are also having plans to start an online master's degree program within the School of Public Health on some other aspects of health. All those are plans that are in advanced stage of preparation, and your visit here to deliver the commencement lecture is deeply appreciated. I also want to thank my colleagues, deans of various schools, Sudarshan, Gudmunder, Kathleen, and of course, Nitesh Bansal, and the faculty members entirely of the Public Health School for really making this experience for our students very special. My doors are open to all of you, and please do visit me and tell me about what we can do more, and challenge us to do more, because sometimes in the busy schedules that we have of universities, we may ignore what is important for the students. And as postgraduate students, you need to constantly challenge us as to how we can do better. Thank you very much. All right, may I invite Professor Sridhar Patnaik, our registrar, to share his views.
Thank you so much, Raj, and very good morning, everyone. Good morning, Professor Rama Baru, and congratulations to all the newly admitted students to the Masters of Public Health program of the Jindal School of Public Health and Human Development, which I understand is the third cohort of the university's Public Health School. And our heartiest congratulations to all the students, the faculty members of the school, led by the Dean, Professor Stephen Marks, and to even the Office of Admissions and Outreach, and to all of us, because you add value to the university. The Vice Chancellor admirably enumerated the various dimensions of the activities of the university, and even very clearly outlined a research and a policy prescription in terms of what students ought to do and what faculty members of the school and the university are expected to do. So be that as a point of departure, I just wanted to quickly ask each one of you to be extremely mindful of the fact that a university which is largely having undergraduate student cohorts, you belong to a special group wherein we have all master students over here. So you come here with your own background and experiences, levels of understanding, maturity, and even social awareness. So that itself is a distinct advantage to all of us at this university, which is quite heterogeneous in terms of, who the students are, where they come from, the kind of programs they're enrolled. So if interdisciplinarity is one of our key characteristic, we request you to embrace that particular purpose of interdisciplinarity in its fullest sense, and also help yourself, and while helping yourselves, also guide other students who belong to other undergraduate programs of the university. And rightly so, because as the Vice Chancellor clearly mentioned, the importance of public health and human development became all the more obvious to us because the pandemic reinforced its importance. And here you have an advantage wherein you will study public health, but you will also gather perspectives and disciplinary insights from other schools, be it public policy, international affairs, the law school, or so many other schools. So which essentially means that while you have an opportunity to develop your methodological insights of the discipline, but you become more compassionate individuals, because when you're part of a larger social sciences and humanities university, compassion is the key, because these areas will always help us realize humanity. So that's what we expect each one of you to undertake as an enterprise for the duration of your stay over here, because that's going to put you on a track to success. And success here just doesn't simply mean getting good grades or whatsoever, but in what manner you're going to contribute to the larger university society within the university and even the society around us. And we request you to undertake and become much more responsible university citizens in terms of, understanding and following all the academic regulations and all the other extracurricular and co-curricular activities to be even taken up within the precincts of these regulations. And I would like to join the Dean and the Vice Chancellor to tell you that you will have the fullest support in whatever manner you want in order to take up your academic activities and your other related activities, so that you become well-rounded individuals and develop the much-needed graduate attributes upon graduation from the OP Jindal Global University. And we are always here to help you, along with the faculty members of the school and all other administrative staff members of the school. And the wholesomeness you can see here, it's not just only the dean of the school and the members of the school faculty and administrative staff who are present here, but we also have a representation from other schools of the university led by the deans and faculty members. So that's the culture of this university, and that's a certain tradition. And now you're going to become a part of this particular tradition as well. And on this particular note, I welcome each one of you to the school. I congratulate you and the school leadership. And we're also so grateful to Professor Ramabaru for having accepted our invite and to address all of us this morning. Thank you so much.
Thank you, Sridhar. May I have the pleasure of inviting Professor Dr. Ramabaru, distinguished professor at the Center for Social Medicine and Community Health at the Jawaharlal Nehru University, to deliver our commencement lecture on the theme, Challenges of Public Health and Development.
Good morning, and thank you very much, Mr. Vice Chancellor, Registrar, Professor Marks, colleagues in the School of Public Health and Human Development, faculties and deans from other schools, students of the MPH program, and my dear friends. It's an honor and a privilege to deliver the commencement lecture at the School of Public Health. When I heard Professor Marks speak at a conference organized by Dr. Deepika Jain several months ago, I was very pleased to learn that the School of Public Health recognized the importance of human development. The center where I taught for 30 years, and it's marking its 50th year of existence in the Jawaharlal Nehru University, is also a center which was located in the School of Social Sciences. Jawaharlal Nehru University does not have a medical school. So these are rare departments, and therefore they have to be treated and nurtured with great care and cannot be in the mainstream of public health programs, which are usually located in schools of medicine. I was very, very happy to hear you, Mr. Vice Chancellor, talking about the limits of a medical approach to public health and the fact that the Jindal University, in fact, is expanding its very understanding to bring in a multidisciplinary leading to an interdisciplinary engagement with the area of public health. For those of you who have chosen to do this program, let me tell you, public health is a very exciting discipline because of its engagement with a range of disciplines: science, medicine, both allopathy and indigenous systems of medicine, and a range of social science disciplines. There is much excitement in multidisciplinarity engagement and interdisciplinarity, which is being demanded of public health today. But I can also tell you that after teaching for 30 years, this is no easy task, because it really requires for us to engage with disciplines. And like the Vice Chancellor said, to engage with various disciplines. We won't become masters of medicine and science, but we have to be adequately knowledgeable in those areas for us to really engage in any meaningful dialogue in public health. I also want to say that, there is a hierarchy within public health. Medicine always takes a much more superior position. We never talk about nursing as a discipline, which is very, very important. And if you physiotherapy or other allied disciplines, which are very, very important when it comes to the discipline of public health. And if you look at some of the Nordic countries, they're all nursing-led models. They're not doctor-led models. But when you look at the Indian situation, public health is largely being defined and in the leadership of clinicians who are in public health. Now, this has been a tension for us, even in the center where I worked, where we've had both doctors and social scientists. But we are constantly, through dialogue, trying to understand how we can bridge this gap, and also to bring nursing into the picture. And more recently, across in the Indian context, the role of indigenous systems of medicine has become very important, and also the hierarchy between allopathy and indigenous systems of medicine. There are contestations, there are many tensions, but there are also models where people have tried to engage in dialogue. In this talk today, I thought a great deal, and I spoke to Professor Marks yesterday. I said, let me give you a historical overview of the discipline of public health and how it has been influenced and how it has engaged and how it has disengaged from the disciplines of social sciences. So I have broadly thought of looking at it in 4 different parts. One, that I would look at history of public health from 19th century Europe as a product of industrialization, and the late 19th century's rise of the germ theory, how it really marginalized the social in public health. Then around the rise of allopathic medicine, the idea of social medicine, which essentially meant that clinicians understood the influence of the social on ill health, and how therefore the discipline of social medicine had its own circulation and influenced public health in post-colonial societies, and the contribution of development economics to public health as espoused in the Alma-Ata Declaration of the primary healthcare approach. So, and I then will come lastly to the contemporary. So if we really look at the practice and discipline of modern public health as we know it, it has its roots in industrialization in 18th and 19th century Europe. Interestingly, it is the social sciences that really engaged with the issue and the relationship between poverty and ill health. And this was largely looking at the working classes, looking at how poverty and disease are linked, and how do you really address this problem in the context of a rapidly industrializing society. Now, disease was a threat for productivity of labor, and therefore, if you had workers falling ill all the time, you needed an intervention that would reduce the morbidity and mortality load, because that would really affect productivity of labor. But the other, which is really the flip of disease causing poverty, is poverty causing disease. And the work of Engels in describing the conditions of the working class in England, where he gives in his essay a very, very deep understanding of the major causes of death, which were infectious diseases, high mortality, infant mortality, maternal mortality, low life expectancy at birth, to make the point that these are the structural inequalities that are responsible for the disease. Now, interestingly, these two approaches led to two very different ways in which you'd solve the problem of ill health. So I won't go into the Engelian because that was not really a route that was pursued, but the Chadwickian, which said disease causes poverty, so we need to address disease. So how do we do that? So at that point in time, which is known as the miasmatic era, you saw the influence of environmental, physical, and the air, water, that, this air, water, space environment had an effect on ill health. So one of the important interventions was to look at how you can have safe water supply and how you needed to have public monies intervention to plan sewage systems, water supply systems. There was also an understanding on nutrition and how nutrition played a very important role in affecting ill health of especially the working class. There was also an understanding of inequalities in experience of both mortality and disease. And so there was comparative work in the poverty studies between the upper middle classes of Victorian England and the working classes. So you had a very rich engagement from social sciences with this question, where ill health and health were one of the elements that they tried to engage with. Interestingly, the early social epidemiological studies focused on the socioeconomic aspects, status, and its effect on health, and a large number of these studies were actually done among factory workers. So you have Villerm's work in France, and I don't want to get into the detail. I'm sure all your lectures will cover some of these details, but essentially to show how the working conditions of the working population had a very detrimental effect on their health status, the kinds of diseases they suffered from, including the long and exploitative nature of the working conditions. But by the end of the 19th century, with the discovery of germ, and later, of course, in the early part of the 20th century, the discovery of antibiotics, really the focus shifted from social causation of disease to the individual body. And during the early part of the 20th century, interestingly, while allopathy was sort of gaining its armaments, as I call it, to become rather powerful in defining illness and disease in the individual body, the subdiscipline of social medicine emphasized the importance of social conditions influencing ill health. And this really there were clinicians who understood, in a sense, the limits of what medicine could do, and where the social ethos of the individual suffering from the disease was as important as treating the illness. Because you could treat a case of diarrhea in children, and then they go home and they come back with diarrhea. So where do you locate the cause? Do you locate the cause in the germ, or do you locate the cause in a host of other factors that would do that? Also, the discipline of social medicine and the more radical stream within social medicine also understood the concept of class and the class differentials in the experience of illness and disease. Now, interestingly, when you look at that period in history, you find that this idea of social medicine had many ideological strands to it. I know in the United States, social medicine meant socialized medicine, and therefore it was anything that was read was, was a rag before a bull. But having said that, a lot of the European, and including, interestingly, the Rockefeller Foundation, the International Health Division of the Rockefeller Foundation, really were very deeply influenced by the European tradition of social medicine. And they worked in very different countries. For example, China, John Grant works in China, and he gets influenced by the Yugoslavian model, which was a socialist country at that time, to talk about how do you organize primary health care. can you just have more and more hospitals in contexts where there's high levels of poverty? Or do you really build health systems in ways in which the three-tier model that we know today really comes to be? And interestingly, this also influences India, because when the Bhore Committee was set up in 1946, the external experts who were on the Bhore Committee were people who were very much drawn and were subscribing to the view of social medicine, and in fact translate some of the learnings from both China, Yugoslavia, and other parts of the world to the designing of the health services in independent India. Now, in the 60s and 70s, the discourse on development gained prominence. And I think, Professor Marks, you talked about growth and development. The growth walas, as they are called in economics, emphasized on the importance of growth, and once you have growth, development would happen. But I think this discourse on development was particularly gained prominence in economics based on post-colonial societies' contestation of and questioning backward, why are we backward, and the inequalities that had come to be due to colonial rule. And as you proceeded to build nations and to imagine how you would build those nations, you had to address some of these questions. And I think the development economics from Latin America, from India, from large parts, and including the Chinese Revolution and the experience of that, really became a global force to reckon with in the world of ideas. Now, when you look at the Alma-Ata Declaration in 1978, it's not something that the WHO came up with. It is, to me, a mark of the circulation of these ideas, and that within the within the discipline of public health, you had people who were completely technology focused. And if you look at the 50s and 60s and the WHO's mandate and design for dealing with a host of communicable diseases, especially in post-colonial societies, it was, okay, for malaria, more DDT, more of chemoprophylaxis. The point is, we are not saying that those are not important, but the question of hunger, inequality never entered this equation. And I think there was another stream within public health, also led by clinicians, including Mahler and a whole lot of other people, who basically questioned the limits to technology. And I think this was very important. There was a debate going on within public health. The dominant debate, backed by pharmaceuticals, gained prominence, and the other was a very lively debate. And a lot of it really came through the critical development literature, which not only questioned the economics of it. They were looking at questions of inequality, poverty very seriously. And if you look at the Indian history of the 5-year plans, the whole emphasis on removing poverty. So these were influences of the development economics literature that was really becoming more and more prominent. And my view is that it is the influence of development economics that strengthened the hands of people in public health who were already subscribing to ideas of social medicine and also to the importance of looking at the relationship between development and health. And I think the WHO's primary healthcare approach, which is popularly known as the Alma-Ata Declaration, this document very clearly spells out the reciprocal relationship between development and health. And that is very important. And they, in fact, categorically state that growth is necessary, but it's not sufficient for development. And I think as an idea, it is a very, very important idea that came up, and it came up out of contestation. It was not something that everybody just agreed to. And I don't want to get into the details because the Alma-Ata Declaration later on never died as an idea, but in practice was contested and sufficiently overturned by the selective primary healthcare approach, which went back to technology as the answer. And another very, very important aspect of the Alma Ata Declaration, which I think Dr. Rajkumar spoke about, is public health is not just a technical subject. It is about values. And I think very often public health, when it is taught in the way it is taught in many medical schools, it is about, okay, do you know your economics right? Do you know how to do your epidemiology right? Have you got all the tools and techniques for cost evaluation? These are not unimportant, but somewhere you have to take sides in public health. And interestingly, the Alma Ata emphasized three very important values or principles: universality, equity, and comprehensiveness. And I think I don't have to elaborate on this, but essentially that no one should go without care and without the determinants of good health, based on the questions around citizenship rights on the one hand, and also to say that it is actually unethical not to be able. So it is, I think what we need to understand is public health is about ethics. It's about morality. And it is therefore a very, very powerful theme within public health, which requires a great deal of emphasis and attention. And equity, because you realize that there are a lot of inequalities. So what is a fair and unfair inequality? How do you deal with it? How do you bridge gaps? How do you ensure? And this is where the Alma Ata very clearly spells out the importance of the role of the state. So the state has to take primary responsibility. Markets do exist, they do acknowledge it, but they say that the state needs to control and prescribe very clearly the role for the market as well. So the dominant player is the state, and then you see how those partnerships can be built. When I speak at this time, those contestations and challenges remain. And while we become more commercial, we are coming back to this question of, is it fair? So I leave it at that. Now, as I mentioned earlier, the primary healthcare approach was contested by the pharmaceutical lobby, the Rockefeller Foundation, and clinicians who felt that the document was political and would require large investments. So hence, although many countries were signatories, including ours, it was a non-starter. So you could easily go to, okay, now what is workable? What is feasible? Now let's get on with that project. The ideas of social medicine and primary healthcare approach may not have made a huge dent in the state-led public services. However, when you look across the world, especially in the global south and even in the north, several community health projects during the late 60s and 70s actually translated some of these ideas. So it wasn't like a one-size-fits-all. There were many innovations, there were many differences. And when I was looking at some of these projects in India, they were largely led by public health doctors. And there is rich diversity in their engagement with communities, practicing and innovating the idea of people's health in people's hands. So these ideas that came up in Alma Ata, the ideas that came up through social medicine, did find spaces in not just health service delivery, but looking at the context of development, critiquing the limitations of the public health sector, and trying to evolve models that were different, influenced, in fact, by socialist countries, but translated into the context where the politics was very different. So, with the end of the Cold War and the decline of socialist economies and the global economic crisis of the late 1970s and 80s, neoliberalism emerged as a new paradigm. It really pushed back the struggles and the both academic struggles as well as on the ground struggles to the periphery. It kind of really jolted many people who had worked for many years trying to build an alternative based on these other ideas. And it as a new paradigm that de-emphasized state participation and emphasized privatization in various sectors, including healthcare. The shift to greater commercialization and privatization of the economy impacted health services access as much as it did issues around livelihood, wages, and access to basic services. Now, interestingly, there was a very strong critique of neoliberal policies in health, and that really focused on rising inequalities in health outcomes, access to services, and out-of-pocket expenditures. And this was seen across the world, because neoliberalism as a global idea was not just something that we experience, but it was seen all over the world, Europe and other countries, where there was a very strong public health system. And now if you read about the NHS, you know how vivid that is. And to correct that was a huge, huge challenge for all these countries. Now, during this period, civil society activism really became a very important cornerstone, which played a very important role in highlighting a rights-based approach to health, exposed the nature of inequalities, both in health and access to health services, and a coalition of civil society organizations came together to form a people's health movement at a global level and also at the national level. I think it's also important that there were certain diseases, especially the HIV pandemic, which brought together activists who brought various other dimensions through the lens of human rights to bear on and put pressure on the health service system, but also on society at large. The questioning of sexuality, the questioning of marginalization, the question around labeling and stigmatizing populations, I think was a very important aspect that came to play in public health. And I think this has its ripple effects. It has come to stay in the discourse on public health. Similarly, the disability movement and the mental health movement. And I think these were very, very important symbols of actually civil society. And when I say civil society, I use it in a Gramscian sense. I don't just mean community health organizations, but I mean academia and other actors that played a very significant role. And there were elements even in the international organizations, the UN and the World Bank, that were actually questioning neoliberal policies. There may have been much fewer in number, but within these organizations, there were questions. For example, UNIFEM, UNFPA, UNDP, which played a very, very important role through its Human Development Report, and I'm just coming to that. In the discipline of economics, Dr. Amartya Sen's seminal work on inequality and development and the capabilities approach influenced the UNDP to come up with the Human Development Report, which was first published in 1992. And it was very important because it also strengthened the hands of the critiques. So, you have to look at levels of ideas and the importance of these. Some people are rather dismissive and say, so what, another UN report. But the fact that the UN report acknowledges and strengthens your hands to talk about a more equitable and a more humane public health is very, very significant and cannot be undermined. And some of these critiques also brought back the importance of social within the WHO with the Marmot's Commission for Social Determinants in Health. This also comes at a time when majority of the Western world and in the less developed countries, you had the coexistence of both infectious and non-communicable diseases. For infectious diseases, you had, quote unquote, a magic bullet, but for non-communicable diseases, it forced the boundaries of public health to acknowledge the limits of what medicine itself can do. It, of course, focused much more on individuals and tried to say that you had to go beyond, change lifestyles, etc. And I think Marmot's training as a cardiologist and looking at NCDs in general brings this idea of social determinants and health to the center stage. There are many in the WHO, the hardcore clinicians and the technologists, who sort of, and if you talk to people within WHO Geneva, they'll tell you, oh, Commission Social Determinants has a small secretariat. You know, we are called in to sort of represent social determinants and health. But the real power still lies somewhere else within the WHO. But having said that, it's a very important instrument for us to use and to use in terms of conceptual paradigms to work with it. Interestingly, and the Lancet sets up a commission on commercial determinants of health. You know, when some of us worked on commercialization, I remember in the early 90s, we were told, oh, come on, it's not at all important. And later on, during the neoliberal era, it was very important. You should show how markets are more efficient than state. But then again, I do see this commercial determinants of health by the Lancet as also this tension and, you know, with how do you manage NCDs, which are on the rise. And therefore, interestingly, the commercial determinants of health is not just looking at health services, it's also looking at the food industry, the tobacco industry, the alcohol industry, and a range of large corporate interess that have an effect on NCDs. The COVID-19 pandemic, in a sense, brought to light and brought to fore the crisis in public health, the weakening of public health systems, and really proved many of the critiques of neoliberalism right. We all thought it was an opportunity for the state to be strengthened, but across the world we don't see that kind of action. Some of us have even forgotten the COVID-19 pandemic and the lessons to be learned from that. So I just want to say again, once again, public health is a very exciting discipline because it actually engages with human lives in its full spectrum. The lived experience of illness and disease, suffering and the disruptions it produces, its social and biological roots, the political responsibility of states. So lastly, I want to end by saying the core values of public health, universality and equity, are extremely relevant as you as young students learn and engage with this discipline. Thank you very much.
And now I have the pleasure of turning the floor over to Professor Sneha Krishnan for the vote of thanks.
Actually, your last comment inspired me to change my script altogether. In divine ways in which the universe works, Professor, I wanted to share that Dr. Nirmala Nair from Ekjut was supposed to be the speaker for today's session, who would have given us an exemplary idea of how these community health projects can not only sustain but also change or push the boundaries in how academia, research, and community health activism all come together and can be replicated at different states and at the national level using PLA. So I really wanted to thank you for, especially Ashita, you for raising that comment, and to Professor Baru to address that. So going back to my original script, I actually want to take this opportunity to extend great thanks to Professor Marx for giving us this opportunity to change course at the last minute. It's been a great privilege to be working with the team behind the scenes. I have to thank extensively to Pooja to start the semester with such a great beginning with crisis, but still you can't see it. And of course, the entire team at JGU, AV team, the logistics team, because we kept changing plans yesterday and today. And of course, I think Anil and Pratiksha, who, despite it being a Sunday, helped us out in promoting this event. I, at the last but not the very least, appreciate all of you who have come here. I want to tell the students that this is just the beginning. You might have so many questions. I think this is the right place to be asking those questions and following those leads. I'm sure over the next 2 years, you're going to be bombarded with events where you can explore and gain more questions, if not the right answers. Thank you so much.